Hi, and welcome to the Geula Mamas Club. This is your place for everything pregnancy, birthing, and babies. I'm Sibi Goodman, midwife, doula, mama, safta, and founder of the Geula Mamas Club. And today I'm joined by Tamara May. Tamara is a physiotherapist that trained in London. She specializes in pregnancy conditions and pelvic floor conditions and works out of 2 clinics in Yerushalayim and Gush Etzion. Outside of work, she's the mom to 5 kids and a black belt in jiu-jitsu. She teaches a weekly class in her home yeshuv of Elazar. Hi, Tamara, how are you?
I'm good, and you?
Baruch Hashem, I'm doing well. So you are between your jiu-jitsu and your knowledge of how the human body works. You are not someone to start up with, huh?
No, absolutely not.
So I'm so excited. What sort of condition can you help people with in your practice? Pregnant women, postpartum, how does this work?
So very commonly when you get pregnant, your uterus gets bigger and your posture changes relatively quickly over 9 months. And for a lot of people, that's absolutely fine, and they carry on through their pregnancy with no problems whatsoever. But for other people, the sudden change in posture and the increase in the hormone relaxin can cause all types of problems and pain, things like lower back pain and conditions like symphysis pubic dysfunction and sacroiliac dysfunction, postpartum things like rectus abdominal diastasis and pelvic floor weakness or prolapse or lots of other different conditions.
Oh, wow. There's a lot of things that you can help with. Before we get started in that, Tamara, how did you get into this whole thing? I'm assuming when you were a little girl, you weren't saying, in first grade, what do you want to be when you grow up? Oh, I want to, specialize in pelvic floor conditions, right? How did this happen?
No, absolutely not. So it actually started very early on in my career as a student. So as a student physiotherapist, you have to do a certain amount of clinical hours, and the university places you in different settings. There are 3 settings that all physiotherapists have to do: your respiratory problems, your neuro problems, and your musculoskeletal conditions. But then there's lots more hours that you need to make up, and they put you in other settings, and not all physios will do all the different settings. And it just so happened I was placed in a women's health setting for 6 weeks, and I really liked it. And
so that was random.
That was what?
Completely random then.
Yeah, completely random that I was placed there. And I fell in love with that type of physiotherapy. I liked dealing with these type of problems, and it went on from there, really.
Wow. All right. So let's dive right into it. Let's start with the most common problem, because I don't know exactly how many we're going to get to. You've got a lot of wealth of information to share. So what's the most common problem that, without coming to you for a visit, and we'll get to that at the end, but if someone is not able to come to you, what could they do on their own?
Okay, so probably the most common problem is SPD. It has 2 names: symphysis or symphysis pubic dysfunction. And what that is the symphysis pubic joint, the front joint in your body, is normally one of the most stable joints in your body, and without pregnancy, it normally does not move. When you're pregnant,
you're talking about the pubic bone in the front, right? Now,
exactly.
That seems to be a solid bone. Now, there is cartilage that connects the 2 halves, but you're calling it a joint. I think of a joint like, the elbow, something that moves. Is it meant to be?
So yes, you have joints that have a lot more movement, like your elbow and your knee. But then as long as there's 2 bones coming together, is called a joint. And normally, this joint does not move. It's very stable. So with pregnant women, you have the hormone relaxin that runs around your body. And this is a good hormone during pregnancy. It means that everything relaxes a bit. All your ligaments and soft tissues are more relaxed. So so everything can move around a bit. So your uterus can move up and get larger. And so that everything can move a bit so the baby can come out of you vaginally. So it's a good thing. But sometimes it relaxes everything a little bit too much. And in this case, it relaxes that very stable joint too much, and it can cause pain.
Is it dangerous at all? Could it separate?
No. So first of all, if you suffer from this, the baby is completely safe. It does not mean there's a pregnancy complication to the baby, as in your baby is still completely healthy. But it's just in terms of how much pain you're going to suffer through.
Okay, but you're not any danger, because when I think of pubic bone separating, it feels like my body is going to like fall into two pieces.
I've never seen that happen. It can get very severe. Some women feel that they can't walk at all and they end up in a wheelchair, but that's really very, very few people. It more so affects people as in they just have difficulties walking around the house and moving, but not necessarily end up in a wheelchair.
Okay. And for I as far as I know in my experience in midwifery, it's common in terms of things that people go through physiologically, but it's still quite rare. I mean, most women will go through pregnancy and never experience this. Is that correct?
Yes, that's correct.
Great. So let's say somebody has it, they're feeling some pain. I'm assuming it's good to start something before you feel a lot of pain, right? They're feeling a little bit of pain. What should they do?
So as soon as you start the niggling, it's very good to start with all the precautions that go around with SPD, which basically...
The niggling you're talking about right in the middle, in the front of the pubic bone.
Yes, the true way of diagnosing SPD is simply putting your hand over the pubic joint, and if you say, oh, that hurts, that's a sign of SPD.
Okay, so somebody could do it themselves. They just put their hand right in the center, in the front of their pubic bone. If there's tenderness, if it hurts, they should do this.
Yes.
Okay, great.
So basically, once the joint starts to open, it's very difficult to close it again, but we can stop it from opening wider. The wider the gap, the more pain the lady will experience. So it's a lot of preventative things we want to do as soon as someone starts to feel that niggling. And basically, we tell people to keep your legs closer together. Once you've opened your legs, you're opening the joint more and you're stretching it, and you're opening it more and causing more pain. So common ways that women often open their legs more is by walking fast. With walking fast, you tend to take bigger strides. Also going up the stairs, I'll tell women, don't go up the stairs the normal way, but go up more like a baby. Both feet on the same step and then both feet on the next step. And that will mean that you're not opening the joint as much.
Wow. Yeah, and when we had spoke over the phone, you were mentioning about getting in and out of the car. It was interesting.
Oh, yes. So getting in and out of the car the ladylike way, I like to call it. So you put your bottom in the car, your legs close together, and you swivel around. And the same way like how they get out on the catwalk and the red carpet. You swivel both your legs round, and then you stand up. So you never open your legs to get one leg out and then the next.
So is this something that every pregnant woman should be doing to prevent this from happening?
No, there'll be many women who can carry on with everything they were doing in the past, you'll get your athletic women that were running marathons, and if they feel they're able to, they can carry on running marathons and whatever sport they did, and it's very healthy for them. It's healthy to stay fit if you can. So this is only for the women who are suffering.
Okay, very interesting. Yeah, I mean, I haven't come across that many women, and most, we are encouraged to keep healthy and keep active, as you said. So this is
Yes.
if they have that pain. Okay, great. What other conditions could someone help themselves out with? And obviously, just going back to that the tips that Tamara gave us are not going to be enough for everybody, but these are small tips that if you can't make it in to have your session, these are things you can do at home. But please make sure you get real help if you need it, okay? Yes, what are some other conditions that someone could help themselves out with at home?
Okay, so let's talk about stress incontinence, which is having some slight leaking if you were to cough or sneeze or run or jump.
That is very common, yes.
This can be for ladies that are pregnant, but also for ladies that are not pregnant.
Is it more often postpartum than, I mean, I think it's much more common after you've had one or a few babies than not, right?
Yes, so the statistics that say that 1 in 10 women that have never had a baby will suffer from incontinence problems, but it goes up to 1 in 3 women looking at the population of women that have had babies. So yes, much more common baby related. The reason being is the pelvic floor muscles go in a figure of 8 around the front passage and the back passage, and they act like a hammock. So they're always holding up your bladder, your bowel, and your uterus. And so they're always working. And each pregnancy, even without a vaginal birth, your uterus is bigger. And you've had 9 months of a heavy uterus stressing down and pushing on your pelvic floor muscles. And that's even without a vaginal delivery. So we're even talking about women that have had C-sections. They've still been weakened over 9 months of a heavy uterus sitting on their pelvic floor muscles.
Is this something that also happens as we age, whether we've had pregnancies or not? Or is that unrelated?
No, it's very much related. Going through menopause, the hormone change also weakens the pelvic floor. The change in estrogen levels really weakens the pelvic floor as well.
Very interesting. All right. So you're making me think of kegels. Is that what that is, or is there something else?
That's what I'm getting at. So something you can do without pelvic floor physiotherapy is to do your kegels at home. Now, commonly what people get wrong with their kegels is there's 2 different ways of doing your kegels.
So let's back up just a minute, because not everybody knows what kegels are. Not kugels for Shabbos that we eat. This is something quite different. Can you please teach us properly from the beginning what kegels are?
Okay. So let's talk about the actual action first. Imagine, now going to the toilet is not the place to do your kegels, but if you want to practice once, there's no harm in doing that. But imagine that you're urinating on the toilet, and that action of stopping yourself urinating, of pulling up those pelvic floor muscles to stop the urine coming out, is using your pelvic floor muscle. So that's the right movement.
So
now when I
tensing those muscles as if you were stopping the flow of urine, that's what we call a kegel.
Yes.
Okay.
And it's absolutely fine to test yourself on the toilet once, but we don't want to get into the habit of being on the toilet and starting your urine the whole time.
From what I understand, that could lead to urinary tract infections. Is that correct?
Exactly, but just seeing if you can do it once will cause absolutely no problems whatsoever.
I've also heard a tip that you should go to the toilet and not to stop the flow in the middle, but to hold back the urine for a few moments before you start. Would that also be considered a kegel?
That would be, but I tend to not want people to associate doing your Kegels with going to the toilet. I like them to think of it as two separate things.
Okay, great.
So going back to the Kegels, there are actually two different ways that all women should be practicing their Kegels. Now, I'm going to move away from the pelvic floor for a bit because a lot of people don't understand that part of the body. So I'm going to talk about runners, which more people can relate to. So you've got your marathon runner and you've got your sprinter. And everyone will agree that both types of runners will use exactly the same muscles. They both use their leg muscles to run their race, but they train in very different ways, the marathon runner and the sprinter. The sprinter will want to build up more fast twitch muscle fibers, and your marathon runner will want to build up more slow twitch muscle fibers, even though these are both muscles in the leg. So we're talking about using oxygen and not using oxygen. We call it medically aerobic and anaerobically. So when I talk about doing your Kegels,
Which is aerobic and which is anaerobic?
anaerobic is doing it fast and quickly, your sprinter, and aerobically is your marathon runner.
Okay, great.
So when we go back to the pelvic floor muscles, we want them to be a marathon runner and we want it to be a sprinter. We want fast twitch muscle fibers and slow twitch muscle fibers. So I want everyone, when they do their Kegels, to do two types: slow Kegels and fast Kegels. So your fast Kegel, it's the same action of, pulling up, but the fast Kegel is going to go contract, relax, like that. And a slow Kegel is contract, hold for 10 seconds. And 10 seconds is a long time. Then after 10 seconds, relax. Then contract, hold for 10 seconds, and then relax again.
So I'm guessing that the fast Kegel is so that when we sneeze, we've got something to hold it back, right? And the slow Kegel is when you're in the middle of cooking dinner or washing the dishes and you have to go to the bathroom, that you can make it there.
Exactly.
Okay, great. So before we go on, why don't we count and all do some fast and slow Kegels together? Can you guide us through that?
Sure. And the great thing about doing your Kegels is you don't need to get into your trainers and, change clothes. You can do it whenever you are doing whatever you want.
Wonderful. Well, this sounds like a something that it's kind of like you don't know how important it is until it isn't there, right? You don't think about that problem, but if you have that problem, there's nothing else that you think about, right?
Exactly. And actually, I'm a very big believer in we should be training girls earlier on to do their Kegels and not waiting till the problems occur. Strengthen early. I actually plan on, when my girls are not quite there yet, but when I teach my girls about periods when they're a bit older, that is when I plan on teaching my daughters how to do their Kegels. Because I truly believe that it's about understanding the body in a non-sexual way, but in a healthy way, and keeping your body healthy like any other part of your body.
Well, I do have older daughters, and I would love to explain this to them. How often, what should I be telling them, or for myself? I mean, how often should we be doing this? And when do we do it? How do we remember if we're not associating it with the bathroom? That's actually two separate questions. Yes.
So every woman should be doing it 3 times a day, 10 fast, 10 slow, 3 times a day. So you could say at the 3 different meals, before or after, I'm going to make that my kegel time. If you're having problems, you really want to up it to 8 times a day. And I tend to tell my patients who need to do it 8 times a day, you won't remember to do it if you don't associate it with something. So I tell them, every time you send a WhatsApp, do your kegels.
Halavai, we should only be sending WhatsApps 8 times a day.
That's what they normally say, and then I say, well, even more, the better.
You can't over kegelize?
No.
Okay, good. Okay, great. So good. So can you guide us through then what that looks like, 10 and 10?
Sure. So let's together do 10 fast ones. You won't really see me do anything, but we'll count together, and this is what 10 and 10 should look like. So contract, relax, contract, relax, contract, relax, contract, relax, contract, relax, contract, relax. I'm glad you're breathing with me. Contract, relax, contract, relax, contract, relax, contract, relax. So they're your fast ones, and your slow ones are contract, hold it, keep holding, keep holding, keep holding, keep holding, keep, relax. Okay? Contract, keep holding, keep holding, keep it, 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 and relax.
It seems to help if I do the breath together with it. Does that make sense?
Yes. Contract, keep it, keep it, keep it, keep it, keep it, keep it, relax. And contract, keep it, keep it, keep it, keep holding, and relax. And again, contract, keep it, 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 relax. And number 5.
Oh my gosh, that's it. It's getting really hard. All right, that is a clear sign that I need a little more Kegel practice.
So you'd want to do that 10 times.
Oh, we're gonna stop there. That is enough. Wow. Got to build up those Kegel muscles because I've been doing the fast one, so I'm not a marathon runner. I did not know about the longer ones.
Yeah, they're both just as important because they do 2 different jobs.
Now, I do remember years ago when I went to childbirth classes myself, we learned to Kegel slowly, like tighten, and then to slowly push out the muscles, and then at the end to retract them again. She said that would help during the pushing stage of childbirth. What's your thoughts on that?
So again, that's a very similar concept to holding it for 10 seconds. But again, yes, it would also help in childbirth as well, just preparing your body for what it's going to go through.
And also, I guess, figuring out, sometimes it can be hard for someone to figure out what muscles to push with. Sometimes ladies are pushing with their face, so if you're figuring out how to use your vaginal muscles to push way in advance, just during pregnancy, I guess, you don't need that when you're a teenager, right?
Exactly. But it's actually from a teenager, it's very important to feel that part of the body, understand where the holes are, and understand how it works. A lot of people want to contract their bottom, their glute muscles, instead of their pelvic floor muscles, which are 2 different muscles.
That is so interesting. Wow. I think we have time for one more. What is the next most common condition that somebody might be able to help themselves with at home without coming in for a session?
Okay, so I'll talk about the sacroiliac joint, which is actually very similar to the front joint, the the SPD joint. So your sacroiliac joint is at the back. And sometimes in pregnancy, again, due to the hormone relaxin, can come out of place. Now, it can come out of place in a few different ways. It can rotate out of place, or it can, what we call an upslip. So you've got your iliac joint like this, and the whole thing moves up, and it's called an upslip.
But we're talking about the lower back now, right?
Yes. Specifically on the sacroiliac joint, which is slightly different to lumbar pain, which is just a little bit, yeah, we're talking about the lower back.
The lower part of the lower back or the upper part of the lower back?
The lower.
So the lowest part of the lower back.
Yes.
Okay.
Okay. So having it move out of place, a physiotherapist can mobilize the joint and put it back in place. But again, what you can do at home is the more you open your legs wide, very similar to SPD, the more it's going to aggravate it. So again, you want to do all the same precautions. You want to keep your legs closer together. You want to walk slower, going up the stairs the same way, getting in and out the bath and in and out of car the ladylike way. So it's all the same kind of precautions, but the pain is in a slightly different area.
And is there also a way to self-diagnose to know if that's the problem you're having?
So that's more difficult. But I tend to say if you're having generalized lower back pain, you're going to want to take all these precautions anyway, whether it's specifically the SP joint or the sacroiliac joint, you're going to want to take these precautions because something's moving.
Uh-huh. And if you do it and you feel a little better, then you know you've hit the nail on the head, I guess, right?
Exactly.
Now, with the SPD, you said the front pain in the pelvis.
Yeah.
Sorry, in the pubic area. I think you had said that it doesn't improve the condition, but it will stop it from worsening, right?
Yes. So that is the slight difference between both of them. The sacroiliac joint can be by a physiotherapist put back into place. Physically, you can move it. Whereas the front joint, we're just stopping that getting worse. We can't actually close the joint closer together until after the baby is out.
Because in the front, there's cartilage that's connecting the two pieces. So that cartilage is softened. Nothing actually is out of place. It's just sort of softening and more like jelly, right? So you can't. Would it help if you, I don't know, bound yourself together and squash things together physically?
So I do actually give out support belts for both conditions, SPD and SIJ, we call it for short, because squashing everything together is going to make it feel more comfortable. Now, that's not actually going to, if you take an X-ray, which you don't need to because the treatment would be the same, but if one was to take an X-ray, the gap would still be there, even with a belt. But it just feels more comfortable because you're stopping it from getting wider, the joints.
So that could be used for both of them. But if somebody
Yes.
has the back pain and they do these ladylike movements that you said, could that actually relieve the pain, or do they need to come in for a session to have the joint put back into place?
So putting the joint back in place would actually completely relieve the pain, but you can take the edge off of it by doing all these precautionary things.
But not precautionary, not like everyone has to do it, only if someone should feel that pain.
Exactly. If you're having a good pregnancy, I highly encourage you to stay active. There are so many benefits to staying active during your pregnancy, obviously if your body allows it.
Right. I have one more question, only if this is quick, because we don't have too much time left. But the condition that I myself had sometimes, and I've seen more often, is sciatica pain. Do you have anything to say on sciatica?
Yes, so the sciatic nerve is a nerve that starts from the spine and it travels all the way down the back of the leg. Now, when you're pregnant, everything moves around, and sometimes this joint can get a little bit entrapped, and that can cause what we call sciatic pain. So stretching.
Well, first of all, can you, from what I understand, before we figure out how to fix it, how do we know if we have sciatic pain?
So basically, there's a certain test that we do called the slump test, and that basically compresses the sciatic nerve. And if that makes your pain worse, then it's sciatic pain.
I remember it as pain going from my lower back down the back of my right leg for me. Is that?
That's very common. So the sciatic nerves start.
Oh, Tamara, you're frozen again. One moment. The sciatic nerve starts what? Oh, 1 minute. I'm frozen. My internet is having issues. Oh my goodness. All right. Try to talk again. Let's see if we got you back.
Can you hear me?
I do. Okay, great. The sciatic nerve
starts from the lumbar spine, specifically L4 and L5, which is your lower back, and it travels all the way down your leg, and that's where you'd feel the pain.
Right or left?
Yeah, depending on where the entrapment is, it can be right or left.
Okay. And so if you have a shooting pain from your lower back down the back of either leg, this is sciatic. Yeah. Okay. So now what do we do?
So a good thing to do at home would be certain stretches. You want to stretch out your legs, you want to bend down and stretch, and that can help relieve the sciatic nerve and help calm all the pain. Also, things like heat can relieve the pain also.
You would put heat on your lower back?
Yeah. Now, I like to be cautious when I say this, because taking hot baths, we're always cautious about when we're pregnant, because it can lower your blood pressure and you don't want to have any fainting spells or anything. But having a warm bath, but not hot bath, and I always advise when someone else is in the home with the bathroom door unlocked, can really help relieve the pain.
Oh, so that way if you feel at all dizzy, if you feel like your blood pressure lowered and you feel dizzy, you can get help right away.
Exactly, and they can bring you a drink and get you out of the bath. Yes, exactly.
And can you show us one of these exercises?
Sure. I'm not sure if it's going to work. I'm from my phone. Should I tell you what I do?
No, I see you perfectly. Those people who are listening on the podcast, maybe we can describe what you're doing while you're doing it, but I see you. It's great.
Okay. So you want to stretch down like this, as in stretching your toes.
Okay, so you're standing up and you're leaning forward and you're just trying to touch your toes.
Exactly.
And that's all you have to do to relieve sciatica, because that just stretches out the area, you're saying?
Exactly.
Oh, that's so fun. Okay. I am sure we could go on for hours, but we are out of time. Thank you. We have learned about front pubic area pain and sciatic pain and incontinence. And we have learned, oh my goodness, wealth of information already. Thank you. This is time for our pop question. I have a pop question for you, Tamara. You ready?
Go for it.
Okay. Close your eyes. Take a deep breath. Relax. And I want you to tell me the first thing that comes to mind when I ask you this question, okay?
Okay.
Okay, let's relax and get into it. Okay. If you were standing before, like, imagine Har Sinai, and you have all the women of Am Yisrael, okay? They're all in front of you.
Okay.
and you have one thing that you can tell them. Anything at all. What's the first thing that pops into your mind?
As a physiotherapist, do your kegels.
Totally up to you. As a physiotherapist or just as Tamara May.
Remember to do your kegels.
Kegels. Woo, that's a good one. All right, so you heard that. I have to remember to do my kegels. That is very, very powerful. Wow. Okay. So that has been a show. We have, this is actually the very second, this is the first recording, but it's going to be the second show that airs. So this is kind of like half and half. Basically, the first recording of the Geula Mamas Club show, which is going to air second. So I actually have some presents to give away, but I don't have them ready yet. All right, we'll put that aside. If you would like to book a session with Tamara and receive 10% off your session, if you mention the Geula Mamas Club, how do we reach you? How do we do that, Tamara?
So you can call me on 05 444 85086.
And I will have it in the show notes. Don't worry if you can't write it down. It will be in the show notes. Okay. How else can we reach you?
Or you can email me at tamaramay.physio@gmail.com.
Amazing. All right. So to book your physiotherapy appointment, did I say that correctly?
Yeah, if you're English, physiotherapy, or if you're American, physical therapy.
Physical therapy. Yes, that does sound more familiar to me. Okay, so to book your physical therapy appointment, if you are living or visiting in the Gush Etzion or Yerushalayim area, get in touch with Tamara, and for 10% off, mention Geula Mamas. Thank you so much. And remember that I love you. Have a good day, everybody.
Nice booking. Bye.
Bye. Hi, so I'm back. And because the episode you just watched was recorded before the Geula Mama magnets were ready, I wanted to make sure you didn't miss out in getting your magnets. So we have 2 magnets, okay? We have one Geula Mama's magnets that says, the thing I'm doing right now is the thing that you are doing. It's the thing. It's the most amazing thing that you could be doing. It's exactly what you need to be doing to bring the Geula and plug into that. This actually helped me because I was running around trying to get everything done, and I kind of got myself into zoom mode, get the dishes and the kids, and I really wanted to stop and think for a moment because I was getting tired. And I said to myself, I just made a magnet that the thing I'm doing is the thing. So what am I doing now? What does that mean? And I continued doing what I was doing, but I was plugged into the moment, and I felt so much better. I felt so much better about it. So I was happy that I had my own magnet hanging up on my door. The other magnet we have is from Ayelet Schwell. She was amazing, right? So what she taught us about was voice, choice, power, and support. So I made a magnet to remind you about voice, choice, power, and support with Ayelet Schwell's name on it. So that is exciting. We're going to give those away now. Who's going to get magnets? We have Zahava Bracha Arki, yay! And Michla Hershkowitz Lichi. Well done, Zahava. And what was your name? Zahava and Michla, yay! And always remember that I love you. Yay, goodbye.